Can you hear me okay? Okay, so thank you for joining us today for this important training on how to conduct a scientific peer review organized by the Global Health and Education Projects Incorporated. My name is Crystal Stanley. I am an intern and fellow of GHEP's Public Health 360. I am pleased to be introducing the facilitators of today's training. Each of our speakers have tremendous experience as shown in their bios, but I will summarize and highlight their experiences. First, I would like to introduce Dr. Hamisu Salihu.
Thank you. Do you want me to introduce myself?
No, sorry, I was just waiting for your screen, but I will move forward. Dr. Salihu has over 450 papers in peer-reviewed journals. He has mentored both junior and senior faculty, both in the United States and across the world. Dr. Salihu is a professor, center director at the BCM Center of Excellence in Health Equity, Training and Research at Baylor College of Medicine in Houston, Texas of the United States. In this role, Dr. Salihu provides leadership and oversight for the center, which is one of the 13 such centers across the United States devoted to the study of health disparities and training minorities in maternal and child health research. The center receives several grants funded by the NIH and the Health Resources and Services Administration. Second, I would like to introduce Dr. Elizabeth Armstrong-Mensah. Dr. Elizabeth Armstrong-Mensah is a clinical associate professor with the Georgia State University School of Public Health in Georgia of the United States, where she teaches in both undergraduate and graduate programs. Dr. Armstrong-Mensah has over 25 years experience in global health, HIV and AIDS, water and sanitation, gender issues, health equity and disparities, mental and child health, program management and evaluation, capacity building, training, and instructional material design. He is the author of a British Medical Association leading in highly research global text published by mentees and Sons. She has 38 publications in peer-reviewed journals as well. Finally, I would like to introduce Dr. Ramit Izwena. Dr. Izwena is the founder of the Global Health and Education Projects Incorporated, which is a nonprofit organization based in Maryland, USA. Prior to Global Health Education Projects, Dr. Izwena was the director of the Division of Research and Maternal and Child Health Bureau's Office of Epidemiology and Research at the Health Resources and Services Administration. In this role, he provided leadership and direction for the MCHB's extramural research program, comprised of interdisciplinary, multi-site research networks, and investigator-initiated grants. He serves as the editor of the International Journal of Maternal Child Health and AIDS as well. His research has been published in leading journals, including Pediatrics, Health Equity, JAMA Psychiatry, Journal of Urban Health, IJMA, and JAMA Network Open. Dr. Izwena will be our moderator for today's training session. Thank you, and I will hand over the virtual microphone to Dr. Izwena.
Thank you so much, Crystal. We have a lot to accomplish today at this training. The goal here are 3 goals. One, we are going to have a quick overview of what it means to write a scientific manuscript. This is going to be some review for some people, but it's also going to be very important to understand what it is that you need to be pointing out when you are writing a scientific manuscript. Then secondly, we will go over to Dr. Armstrong-Mensah, who will walk us through what it means to be a peer reviewer for a scientific journal. And during that work, Dr. Armstrong-Mensah is going to tell us exactly the ethical, the academic, the scientific issues. And myself, I am going to walk you through the mechanics of actually conducting a review for 2 of our journals. So I'm really excited And after the 3 presentations, we're going to open the microphone up again for people to ask any and all questions. So please kindly mute yourself if you're not talking. And, if you have a pen, get your pen ready to do some note taking as well. And make sure that you have your questions you have your questions written down so that you can ask for all our facilitators. Again, welcome, and I'm looking forward to learning and co-creating with you. Thank you so much. Brown, now hand the virtual room over to Dr. Sally for his presentation.
Okay, good morning, everyone. Could everyone see my slide?
Yes.
Okay.
Yes, we can see.
All right. Okay, that's good. Thank you so much. This is a very important topic because, especially if you're at the beginning of your career, because the currency, if you're in academia, even if you're not in academia, if you're in school and you want to be taken serious, one of the ways to show is that you have some research published, peer-reviewed, published, and you have that documented in your CV. That is quite, that impresses your employer. But for those of us who are in academia, right from the beginning, if you really want to be taken serious and then promoted and then looked upon as someone that is credible, then you have to be productive in terms of peer-reviewed scholarly work. So today I'm not going to be able to cover everything, but I will try as much as possible to cover the essentials. And I'm going to start with certain things that we need to understand before even picking the pen to start writing. Before you proceed with writing a paper, make sure that the topic you're going to talk about is a topic that will contribute to your career. Don't write on something that may not be impactful in your career. So that's the first thing. Second thing, be passionate about the topic so that you don't feel fatigued when you're going through it. You don't feel bored. You feel, okay, this is something I'm excited about. And that is the only fuel, the only energy that will take you through. And once you have those elements in you, the next thing is you have to have a research question or a hypothesis. Now, some people get confused about what a research question is and what a hypothesis is. It's very simple. A research question is a question like, do married people die early? That's a research question. But if I say married people die early, that is a hypothesis. It's like one is, I am not very sure about it, but I'm thinking about it. That's the research question, whereas hypothesis is more potent, it's more powerful. It says something, a statement of assertion that requires some evidence. It's like in a court of law when you say, oh, did this man steal your wristwatch? That's different from saying this man stole your wristwatch. So the second one is more impactful. It tends to be related to further research, et cetera, et cetera, et cetera. So there's no time to go into detail, but it's very important to know that a research question is a milder form of the topic presentation you're going to make or the topic you're going to be treating. Hypothesis is the assertion that you are very convinced and you would like to show evidence for or against that. All right. Then the next thing is you need to really have an exhaustive literature search. If you don't do that, then you're going to be in trouble. I think that will be the next step. Have a topic next, research about it, read about it. Do not be tired about reading about it. Read all that has been written about it, at least the essential ones and the most recent ones, so that you know whether really a topic is going to contribute something or is something that is stale. People have known about it. There's no need to waste people's time. Then once you do that, you've done your literature search, et cetera, et cetera. The next thing is, all right, how am I going to approach this topic? These are preliminary steps. And what I usually tell my students is this, because people get confused and they say, okay, you know, I'm going to be going to the hospital. I'm going to ask some patient this. I'm going to ask that. No, that is not the proper way to do it. The first step in approaching a topic is to ask two questions. One, what is my exposure? Two, what is my outcome? If you can answer these two questions, you can proceed, you have a topic. If you cannot answer that question, you don't know what you cannot define really your exposure or your outcome, then you are still in the process. Do not start writing because you don't know what you're talking about until you can define that. And I'm giving it because your hypothesis actually is the definition of where am I beginning and where am I ending. It outlines the road that maps what you're going to talk about, what you're going to write about. For instance, and I've given an example, obesity and stillbirth in the United States, okay? This is a topic. What is the exposure? Obesity. What is the outcome? Stillbirth. And another important thing which we're going to see subsequently is that knowing your exposure, knowing your outcome, once you know these two things, you define them, then you know your hypothesis, you know your research question. For instance, in this example, obesity and stillbirth in the United States. The hypothesis would be what? Obesity causes stillbirth. What is the research question? Does obesity lead to stillbirth, et cetera, et cetera? So you can see that a hypothesis cannot be formulated if you do not know what your exposure is and if you do not know what your outcome is. What is an exposure? An exposure is a primary risk factor of interest. Outcome is the event that happens as a result of triggered by the exposure, okay? All right, once you've defined your exposure and your outcome, the next is to link the two, because hypothesis is the linkage between an exposure and your outcome. That's just what a hypothesis is, right? And then you can further write more hypotheses under the general hypothesis, the general topic that you're talking about. The general topic is about obesity and stillbirth in the United States. And you can have, and I've given an example, several hypotheses. Usually do not go beyond 3 hypotheses. And actually, when I used to write as a younger assistant professor, I used to approach it this way. And it makes it much easier for me to present my work without even thinking sometimes, because it's just automatic. For instance, the first hypothesis would be maternal obesity is associated with stillbirth. So that would be the general umbrella of the topic. So I'm going to discuss here, right here, the analysis would be what? Okay, how many women are obese, how many are not obese, compare the two with regard to stillbirth. So that's hypothesis 1. So I'm going to work under that umbrella. Hypothesis 2 is there is a dose-response relationship between the severity of obesity and risk of stillbirth. So what I'm saying is the worse the obesity status, the worse the risk for stillbirth. It's still under the general topic, but I'm going deeper now. I'm making it more attractive. I'm making it more advanced and therefore more impactful and more interesting as a paper. Then I might finish with my final hypothesis. Maternal gestational weight mediates the relationship between obesity and stillbirth. So you can say this is like the bridge. What explains the bridge? So the first hypothesis is that there is some association. The second is that this association is worsened when the exposure is bad, and the more the exposure, the worse the outcome. And the third one is what? I'm looking at the bridge. What explains why women who are obese tend to have stillbirth? So it's like I have my exposure on the left-hand side, my outcome on the right-hand side, and in between is the linkage or the bridge. So that is the way, that is one way of looking. There's several ways of looking at hypothesis, but we don't have time today. So let's go to, that's why I'm restricting myself to these 3 examples. All right, so that is by way of general introduction in terms of handling a topic. How do I handle my topic? How do I get it? How do I know that I have a topic? You don't have a topic if you cannot define your exposure and your outcome. If you can define your exposure and your outcome, you have a topic. That's what I'm saying. Now, once you have the topic, the next thing is, all right, you've read the literature, et cetera, you have your result. How do you write a paper? There are basically 4 components to a paper. The other one, abstract, is just what? A brief, you can pick the sentences from all the 5 given here, or the top 4. So the first is introduction, method, result, discussion, and then finally references. But today, we might be able to do 2 or 3 of these. I don't know what the time is going to allow, but let's begin with introduction. Now, the introduction of a manuscript is like an opening statement in court. What does an opening statement do in court? The first impression. If your opening statement in court is good, is quite impressive, you've already won 50% of the battle in court. That is it. So you want your introduction to be what? You want it to be compelling. You want it to attract. You don't want the reviewer to look at your introduction and say, oh my God, what is this? I don't even have the time to read. Really, seriously, I have my golf tournament and this, I don't know what this guy is talking about. You don't want that kind of thing, because that means that the rest of the paper will be read without interest. All right. All right. Now, how do you make it interesting? How do you make your introduction to have a punch? That's what I call it. I used to call it Mike Tyson punch to my students. Have a mic, something, a knockout kind of thing. Well, there is a big mistake that people do when they write the introduction section of their manuscript, and that is to write a long sentence. Somehow people believe that the longer you write, the more people respect that you know how to write. The opposite is true. Let me give you an example of one of the papers I've read, and I want to tell you what is bad in it. So read this introduction. This part of the introduction, it says, the new coronavirus, I'm reading here at the bottom here as an example. The new coronavirus has spread throughout the world in a very short time and now has become a pandemic, with most infected people showing symptoms such as dry cough, dyspnea, tiredness, and fever. And the COVID-19 infection disrupts various organs, including the liver, kidney, and nervous system. This is, I'm not saying it's wrong, but the fact that the reviewer cannot even breathe, it's like, okay, I'm not going to continue with this. Just forget about this paper. You have to give a breathing space to the reviewer. And then if you write so many things, so many ideas in one sentence, you lose the punch that your sentence or your paragraph is supposed to have. So how do we correct such things? Now, this is, how do we correct this sentence? Now, the best way to do it is to look at the anatomy of the entire sentence and look for ways where you can insert what we call in English language conjunctions, something that will link things. And that is what I try to do. So where can I write and, with, such, etc., etc. So these are things that can connectivity. Once you identify where connectivities are, then at those nodes, you can modify the sentence, right? Let's look at it. So the first step is to find where you can insert these and insert them. The new coronavirus spread throughout the world in a very short time and now has become a pandemic, with most infected people showing symptoms such as dry cough, dyspnea, tiredness, and fever, and the COVID-19 infection disrupts various organs, including the liver, kidney, and nervous system. It's better, but it's still not impressive. It's still not elegant. That's what I meant to say. Yeah, it's not elegant. It's okay, but it's not elegant. So how do we make it elegant? By making it shorter. So if I were this writer, I would have written, and actually I suggested this to the writer. This is the way I'm going to write it. The new coronavirus has spread throughout the world in a very short time. I would say, and now has become a pandemic. In one sentence. Most infected people show symptoms of dry cough, dyspnea, tiredness, and fever. Full stop. Infection with COVID-19 disrupts various organs, including the liver, kidney, and the nervous system. So that non-stop, endless sentence has been has been merged into 3 sentences. So has been reduced, or not reduced, but has been converted into 3 sentences. So that is one aspect. We don't have time for more examples, but this is a very common mistake that people do when they write in the introduction section. Okay. Other things is that do not write several pages for the introduction. If you write more than 1 page in the introduction, then probably you are saying things that are not important. And probably you're going to make the reviewer mad, because many of the things you're going to talk about add simplicities. They are not things that will really contribute to your paper. So usually I tell my junior faculty as well as students, do not write an introduction that is more than 1 page. Unless if you're creating something new, a new enzyme pathway that we are introducing to people, and an entirely new concept in instrument development. Okay, if you're doing something fantastic, then something new that people don't know about, that each paragraph you write in the introduction section is what, like teaching people new things, making them understand and to appreciate what you're going to talk about. Now, there are exceptions to this, like if you're writing a thesis, yeah, you can write several pages, or dissertations, for which expansions are needed. And there are reasons why in these cases you need to write a lot about what you're talking about, okay? All right, now, there is a rule I tell people: thou shalt not start to write until you have an outline. Please, this is probably one of the most important things in terms of being writing something that is good. Do not start writing when you're not organized. Have an outline that shows what you want to talk about. Once you have exhausted the list of what you're going to talk about, the next thing is organize then your thoughts in an outline. Saying paragraph 1, this is what I'm going to talk about. Paragraph 2, this is what I'm going to talk about. Paragraph 3, this is what I'm going to talk about, etc., etc. Okay. Once you do that, then you can now reorganize the paragraphs. Let me give an example of how to reorganize a paragraph. Let's say I have an outline like this. I want to write a paragraph, but I want, first of all, before I start writing, put down my ideas. One of the things I want to talk about in the paragraph is importance of early treatment in affected individuals. So I'm talking about prediabetes, oral, okay, this is an example of oral hypoglycemics in prediabetes, meaning oral medications in people who are about to have diabetes. So I have some ideas I want to talk about, and this is how it comes, a diarrhea of ideas. People have tons of ideas. So I will write it down. Importance of early treatment in affected individuals, morbidity and survival among people with prediabetes, burden of prediabetes. So you can see, let's say I have 3 ideas, each one important, but are they written in sequence? No, this is just an outline. So the next step is, after you've written down your ideas and outline, the next thing is what is called sequencing, right? So sequencing, that means that how do I organize these ideas so that there is a logical sense in what I'm talking about in my thought process. There is no bumps. Bumps in thought is one of the most common mistakes that people do when they write. So in order to prevent bumps in the thought process, the example I gave before, I could say, okay, I'm going to talk about the burden of prediabetes first. So the number 3 now becomes number 1. That makes sense because people would like to know, okay, why is this important? Then the next thing is I will talk about morbidity and survival among people with prediabetes. So that means that number 2 idea should come next. And then finally, importance of early treatment in affected individuals. So you can see it makes sense now that I should start with the burden, talk about its significance, and then finally, what can we do about it?
Let me.
Right?
I'm learning something, so I'm going to the room.
Hello. Okay. So now, finally, all right. So, Another thing we should avoid doing, sorry, right, so we have the paragraph, sorry, I had someone saying something, I couldn't get what the person was saying. All right, so the next thing I want, so that's one of the problems that people encounter when they write sequence. You have to learn how to do that. And the best way to do sequencing is, first of all, write down your ideas, and then you go, this next step is sequence. All right. Now, another thing is that do not write things that, people tend to write the way they speak, and that sometimes they don't even know that what they're writing is not appropriate. Like some people write proverbs or quotes, like the saying that the more sugar in your body, the sicker it becomes, holds true for diabetes, for pre-diabetes. This is not formal. This is like when you're conversing, when you're in a conversation, talking with other people. You can say pre-diabetes is a relatively mild glycemic state without symptoms, something. Say something about it in a way that the scientific world will respect what you're saying. Okay. Now, still about the structure of the introduction, and I'm going to summarize this at the end so that I can give you, and I'm going to send this slide subsequently. I'm making some changes too. So another thing is, what you want to give is the first part of what you're writing, or part of what you're writing should be in the introduction. The most important, the first paragraph, usually I write about the background. Give a precise background about what you're talking about. And please, when you're writing the introduction, do not exaggerate, right? Don't say something like our paper is the best ever written in the field of pre-diabetes by anyone on this planet. No, don't say that. You might be making a mistake, and that is like hubris. It's not modest. So instead, say something like, to our knowledge, yeah, our paper presents the most comprehensive data related to pre-diabetes. Say something like that. So, but do not come out too arrogant and saying that you're the first to do something when you're not 100% sure. Then subsequently, after you've given a background, then give some idea about what has been done in that area so far, so that that is only possible if you've done a literature search, okay? And then avoid digression, stick to the point. When going from one subheading to another, do that smoothly without a bump. Let's say, for instance, I want to talk about diabetes leading, but if you have to change what we call inflection in writing, if you want to slightly create some contrast or create some, or attach some significance to something that, or create some kind of transition to the next thing you're going to talk about, you can still do it by inflection. Let me give you an example of an inflection in the introduction. For example, supposing you have two separate ideas that may involve digression. You want an inflection, right? You want to digress, but you want to do it smoothly. One thing is, you've written diabetes leads to poor fetal survival, and the burden of diabetes is rising. And you want really to bring the two together in a way that it will not show a disruption in ideas or lack of alignment in ideas. Yeah, that's the word, misalignment. Right? So although the two statements diverge, you could link them to avoid digression as follows. So how do I put it in a way that it shows some kind of technical elegance of inflection? Well, you can write the burden of diabetes is rising and could lead to poor fetal survival in pregnant diabetic mothers. Well, these are two separate things, but the way I've put it, using and conjunctions are very good at doing this. You can see that I've used and, sometimes with, sometimes such as, sometimes. So there are several ways of creating inflection, meaning making sure that two apparently different train of thoughts come together, and they permit you now to continue talking about pregnancy and diabetes. So that is the purpose. That's the purpose. You want to inflect from generality to specificity. So that is very, very important to know how to do. All right. Now, if I had written them separately, they would not make any sense. And this is the problem I find, especially with people who are early in writing. It's normal to make such mistakes, but what is better is to correct the mistakes. So one of the, and that is poor mentoring. Sometimes people don't get well mentored in this kind of business, and that is the problem that we're trying to address. So you write the burden of diabetes is rising. Poor fetal survival is one of its outcomes. If you write something like this, the reviewer will say, oh, this person does not have a good idea of how to write a paper. Once you have that kind of impression being triggered or that kind of impression being displayed, the reviewer will not accept that paper. So try to make your writing elegant, and it's very easy to do. It's just a question of practice, okay? So what else should we talk about in the introduction? Use references to support your assertions, especially my students. They'll write a lot, beautiful things, but then it's like they're writing their own opinion. There are no references. If you ask them, what are the, oh, I'm going to write them later. By then you'll be confused when you go back and you have 100 references. How are you going to get them back? So that is the problem. When you write a statement, please, you will lose it if you don't have the relevant reference there. So the way I do it these days is either use endnotes, or sometimes I just use, if I'm in a hurry, the comment box and say, okay, poof, I have a reference called Salihu et al. 2011 or Salihu et al. 2016, etc., etc. Okay. All right. So references always write them. Without reference, reader will think it is your opinion and loses impact. And you want facts, not opinions, etc., etc. That's why it's very important to write those references. So sometimes my students ask me, what references should I use? I have more than 50 references for this single sentence. So what I tell them is, okay, first of all, the references should be relevant to the population we are dealing with. As I'm writing about Africa and malaria, then all of a sudden I start talking about Korea. You know, then it becomes like, I don't know what I'm talking about, because the people in Africa are completely different, right? So maybe if I'm writing about people in Nigeria, it will be okay if I bring studies from Ethiopia, studies from the Sudan or something. Yeah, these are people that are relatively similar in terms of their exposures. So that is acceptable. So that's one thing you should do. Two, sometimes people say use high impact journals, but sometimes sometimes high impact journals may not even have the appropriate reference. So what is important is look for well-written papers that are relevant, especially if you are writing about continents that are completely way off. Then you should be very, very careful. Make sure that what you're writing, the references you're talking about, really relate to these people. Okay, now this is a summary in terms of how an introduction should look like for you. First paragraph, this is summary take-home message. First paragraph, provide a succinct background about the subject matter. This is where you talk about the importance of the topic, e.g. burden of morbidity and mortality, and how other health consequences, both short and long-term. Be precise and avoid exaggeration. Support your statement with most recent references. And then the second paragraph is define the scope of current knowledge briefly. What do we know so far? What is the most current knowledge, data, progress, advances? So this is where you give us an idea about what has been done in the literature. Then the third paragraph is what? What are the gaps? Despite all these things you've talked about, what are the gaps in knowledge, practice, understanding of specific areas, et cetera, et cetera. Then finally, the fourth paragraph is, what is your study about? This is why you describe your study, okay? Because of this gap in knowledge, gap in practice, gap in the literature, we sought in this paper to address the issue of maternal morbidity and mortality with specific emphasis on racial, ethnic or racial/ethnic disparities in the United States. Accordingly, we have the following hypotheses, something like that. So you can see, so this is an example, and I'm going to send it to all of you so that, and this is what I use up till now. I use this, I mean, I don't write it down anymore because it's already automatic in my head. I don't know whether we still have time so I can go to materials and method, the second section of the talk. If I do, I'll continue. If I don't, I can stop here. Do I still have time?
Dr. Salihu, yes, go through the materials and methods, and then
I stop.
Yes.
Yeah. Then we can continue next time. All right. Now, the method section of a manuscript is very, very important. And most manuscripts that have been rejected, most of them are due to faulty methodology. And that's why if your method section is good, it's very unlikely that your paper will be rejected. Usually when the method is solid, people believe that, okay, the rest are just minor things, kind of making it much better, etc., etc. So the method section is very important. So spend the time to be as meticulous, comprehensive, and concise as possible. And again, do not, even though the method section is it is technical, do not start writing until you have an outline. Please do not do that. That is very, very, that takes away some technical beauty in your writing. If you just start writing as if you're writing a text to someone, no, have an outline first. All right, this is my outline, and this is how I've been, and believe me, most of my students, now they are professors, etc. When I read their papers, it's like they have taken this as what? As the Bible or the Quran, and they are following it religiously. And it has become like an automation, AI, something, that they have built upon. And it's beautiful because you can see that they have used this foundation, and the way they write, some of them write better than I do now. So that is the purpose. The purpose is not for you to write as good as I do, but to write better than I do. Seriously, that is why I'm giving this talk. So the first thing I do is I describe my study design. Then the next thing I do is description of study population. The next thing is data collection procedure. Then I describe my variables, and I have a way of describing my variables. The first one is what? My exposure variable. So the definition of an exposure variable is your primary risk factor. So if you have several risk factors, you want to take one as the primary one. That's the definition of an exposure. Then I'll talk about the other risk factors. Then I'll talk about the primary outcome variables. Maybe stillbirth is my primary outcome variable. Then secondary outcome variable, maybe pregnancy complications of the mother constitute my secondary variable, and then other variables that are of importance, maybe the healthcare environment, social determinants of health, whatever you want to talk about. But this is the way that I think will impress, and it has been impressive. People think I have a magic writing. No, it's organization. If you're well organized, you can write 10 papers in a day. But if you're not organized, it might take you a year to write a paper, seriously. So once you organize it like that, then it's just like, you plug in whatever you have. Then next is data analysis. And I'm going to talk about data analysis at the end of the roadmap. At the end of our talk. And then finally, you talk about ethical consideration, RB issues, informed consent, etc., etc. All right, so description of study design. So the study design is what? What is the framework? What is the architectural framework of your study? That's what study design is. It's like an architect. If you want the architect to build a house for you, you need a design. So a study needs a design. All right. So I'm giving an example here, of a study design, a paper that we've written, and how did we write our design? The design. So the design could be cross-sectional, perspective cohort, retrospective cohort, case control. So I have a different talk I could give some other day about study designs. If I have time, I can talk to you folks about study design. But an example, just to give you an idea, this was a cross-sectional study. So a cross-sectional study, it's like, for instance, I send a survey to you guys. So that survey, you tell me all about how you're feeling. Maybe you feel depressed, you don't feel depressed, you smoke, you don't. So I get a lot of information at one point in time from you. So that is a cross-sectional study, okay? All right, this is an example of a cross-sectional study, an interview, a questionnaire, validated questionnaire, etc., etc. So talk about your study design, or if it is a clinical trial, describe it. Say, okay, we conducted a randomized controlled clinical trial that is double-blinded, blah, blah, blah. So that's an example of what a study design is. That should be the first thing you talk about. The next you talk about, you describe the study population. The study population means, okay, what is the population? You know, here, for instance, the example I've given, students in their senior years in public universities are the population. In other studies, maybe a pregnant woman attending a clinic here in Houston, et cetera, et cetera. So the next thing is where. You have to tell people where the study is conducted. And usually, especially if you intend to send it to an international journal, please don't think that everybody knows Houston is in the United States. Please say Houston, Texas in the United States, something like that. Hello? Okay, so the next thing is talk about inclusion and exclusion criteria. Inclusion means who are the people that are included. In this example, residents of Houston who have been living for at least the previous year. Who have you excluded? For instance, people without prior hospitalization for an acute psychiatric condition, and so on and so forth. So this is about the population so that people have an idea, okay, what is the population like? Where is it? Where is the population resident? And who has been included or excluded from the study population? Then the next thing is data collection procedure. Here, people would like to know, how did you collect your data? Did you take the blood? Or did you just ask them questions? So you have to talk about it. How did you ask them questions? Did you use a validated questionnaire? Things like that. So this is where you give ample information about the kind of data you've collected. You've collected socio-demographic data characteristics like their age, marital status, etc. You've collected also blood samples from them, and then etc. etc. So this is where, and if you send them again a second time, this is why you describe data collection procedures. Okay. Also under the data collection procedures, talk about the kind of instrument you've used. Talk about their validity and reliability. And that way people will know, okay, this is what you've used to collect your information. What you've used is valid, or maybe what you've used is not valid. And if it is not well validated, you have to give reasons why you've used that kind of instrument. And then talk about how you delivered, how you administered the instrument. Was it by computer administered? Was it administered by a trained interviewer? Or how did you get that information? Who collected the information for you? Now you're done with the data procedure. This next thing is study variables. Remember, I'm still following the skeleton outline I gave you before. So the next is study variables. I start with my exposure variable. You define your exposure. All right. So an example, assuming that we have a topic, use of electronic medical records in hospitals improves quality of patient care. Now here in this example, what is the exposure? Electronic medical records in hospitals. And what is the outcome? You believe that use of that will lead to what? Will improve quality of patient care. So quality of patient care is now the outcome. All right. Now, given that, the way we can define, for instance, our exposure, which is use of electronic medical records as follows. We define use of electronic medical records as the utilization of HIPAA compliant and certified electronic medical records within at least the previous 2 years by a hospital for patient-provider encounter. So that is our definition, and you can make it more elegant. And then you define also your control group. All right. The control group are hospitals that did not use electronic medical records that are HIPAA compliant and certified. So because you want to compare the two groups. One is a group of hospitals that are using certified medical records. The other one is a group of hospitals that are not. And you want to compare whether the use to find out whether the use of electronic medical records improve quality of patient care, etc. All right. And then what is your primary outcome of interest? Maybe our primary outcome of interest is we're looking at improvement in quality of care. We can look at hemoglobin A1C among diabetic patients. That may be the measure we could use. And then we will define what it is. We will define how it is captured. We will define how we use it. That is what is needed there. Then the secondary outcome may be patient satisfaction levels. We define how we did this. We could say, okay, we give patients, all our patients, patient satisfaction form that contain 20 questions that cover the following domains, et cetera, et cetera. All right. So once you do that, the last thing is you define other variables. So what other variables have you used that you would like to talk to us about by giving us a definition and explanation, and how do I capture? And finally, data analysis. Now, this is surprising because most people, when I speak with them, especially younger students, they believe that the method section is nothing but data analysis. But you can see now that the method section contains several elements, and one of which is data analysis. And the data analysis contains two portions. Any paper you read, the first portion is known as descriptive analysis. Now, this is, in most cases, a univariate or bivariate analysis. Now, I'm not going deeper into this. Maybe another day we'll talk about descriptive analysis, univariate or bivariate. And then the second part is about inferential analytic. So this is usually a multivariable analysis, meaning using regression analysis. Now, once you know that the data analysis section contains two portions, you really don't need to worry. And you find out that when writing a paper, it becomes very easy because you know what the content is going to be. And you know in each part of the content what you're talking about. The first part has to be descriptive. If you write the inferential first, descriptive second, the reviewer will know that you don't know what you're talking about. All right, finally, I want people to take, this is probably one of the most important slides of my life. I created it, and all my students have been sending me good comments about this slide. This slide. This is a slide. If you want to have some idea, maybe another day we'll talk about this slide. This is about data analysis section of a paper. If you don't know this, you are unlikely to be able to write the data analysis component, and you are unable to understand when you read a paper. That is what this means. And it's unfortunate there is no time, but I have about 2 minutes. I'm going to stop here, but this is to give you an idea about how do you go about determining what you're going to use when you're analyzing your data. And it gives you the pathways, you know, right to the bottom. For instance, if the first question you ask is, what is your outcome? Is it continuous or categorical? If it is a continuous outcome, then you have to go to this cloud. You are going to choose from this cloud. If it is a categorical outcome, you're going to choose from this cloud. Okay. Then the next question is the exposure continuous. You see what I'm saying? If you don't know your exposure, there is no way you even know how to do data analysis. So the next question is exposure. Is it continuous or categorical? If it is categorical, you follow here. If it is continuous, you follow here. The next question you're going to be asked is it a bivariate association you're looking for, meaning simple relationship between the exposure and the outcome? Or do you want to do something predictive? You want to include other variables in the model? Well, if it is just a simple one, you follow here. If it is something complicated, you follow here and you do linear regression because the outcome is continuous. However, if you are not interested in making doing some complicated analysis, just a simple bivariate, and bivariate means two, and what does the two stand for? The two stands for what? Exposure outcome. If it's just simple relationship, then the next question you have to answer, you have to respond to the next question, which is how many groups. If it is 2 groups, you do the t-test. If it is 3 groups, you do ANOVA. Okay, so we can go through all this, but I think there is no time. My time is up, so I'm going to stop here. But this would have been a very interesting discussion, and would have gone through an example to be able to understand what I'm talking about. But I'm going to call it a day here. And thank you so much for listening. If you have any questions for me, I'm more than ready to answer. We'll continue next time, and maybe we'll have more time to discuss about these things with examples. Thank you so much.
Thank you so much, Dr. Salihu. I am getting a lot of comments here on the chat box of gratitude for sparing us your time, seeing patients, directing the center, leading the IJMA as well as the IJ Transmet journals and the several community work that you're doing. We are really, really appreciative of this. And certainly I'm hearing a lot of people say that they would like to delve into some of the sections. So thank you so much. So guys, join me to use your electronic thumbs up to thank Dr. Salihu. So now that we have gone through what a solid paper looks like, we are going to transition to Dr. Armstrong-Mensah to walk us through what it is when you are reviewing a paper, how to look out for these specific items in the paper you are reviewing. And Dr. Mensah has been doing this. She's a guest editor for BMC Journal. She's an author of Global Health paper. She leads several students here from United States to Ghana on field work in global health and in public health. So please join me. Brown, can we hand over to Dr. Armstrong so that she can walk us through what she looks at when papers are assigned to her, when papers come to her desk, exactly the things that Dr. Salih will be looking at as the executive editor of a journal. Any paper that comes to IJMA, he takes a quick look and determines whether this paper should move forward or even be rejected at the desk. So join me again. Let's listen to Dr. Armstrong-Mensah. I'm not going to be talking. You don't need to listen to me. Listen to the experts and take what they are saying. Brown, can you hand over to Dr. Armstrong-Mensah?
Well, thank you, Dr. Zwini. Can you all see my screen? Can you see my slide?
Yes, we can.
Okay, so I just like to begin by thanking Dr. Salihu for a very informative and interesting presentation. Some of the examples got me laughing in my seat because I kind of like see where he's going, but thank you so much. And Dr. Zwini, thank you for this opportunity. So yes, my name is Dr. Armstrong-Mensah. In the next few minutes, I will provide a brief overview of why peer review is important in global health, as well as in academia. Specifically, I'll begin by talking about the importance of peer review in global health, and then I'll move on to talk about the importance of peer review in academia. I will wrap up by sharing some tips for conducting a peer review. So why is peer review important in global health? Well, it's important because it's integral to scientific integrity, right? People all around the world are publishing on various global health issues. But the question is, which of these publications should one trust, right? Conducting a peer review helps journals to filter out flawed articles and to present the global public with science or material that can be trusted. Conducting peer reviews in global health is also important because accurate science helps in shaping policies that affect societies. Some of the work done on the global front are translational in nature and have implications for policy making. Thus, by filtering out inadequate or flawed information and data, peer reviews strengthen the quality of research that are translated to inform policy and to promote sustainable development and global health security. So now to the importance of peer review in academia. As Dr. Azwini said, I'm an academician. Now, a peer reviewer's critique and suggestions can help authors fine-tune their work and thus make the work more valuable to their readership. I personally like to receive peer reviewer feedback, and like some of my colleagues, they see it and then they are kind of like flustered. But I like it because I see it as expert advice at no charge, which if I yield to and use, will enhance my work. Secondly, in academia, if one engages in peer review work, it fulfills an important employment requirement because one is seen as doing community service. See, at Georgia State University, in addition to teaching and conducting research, I'm also required to engage in community service. Now, peer review also helps with the promotion process because one is seen as contributing to science and research. It also gives one visibility and recognition in the journal world because editors see what you bring to the table and thus seek you out. You know, I receive lots and lots of manuscripts to review, but unfortunately, due to time constraints, I'm unable to accept them all. Doing peer review is also fulfilling in that it gives one the feeling that they are contributing towards the publication process. At this point, I'm going to share some points or some tips for conducting a peer review based on my personal experience. And I've broken this segment down into 3 sections: before you accept, what to look for, and how to provide your comments. Now, in the last 3 years, I've conducted peer reviews for several journals, including BMC Public Health, International Journal of Environmental Research and Public Health, International Journal of Maternal and Child Health and AIDS, IJMA, and the Journal of HIV, AIDS and Science Social Services. Now, before you accept to be a reviewer, read the manuscript, right? It's difficult to tell what a manuscript entails just by looking at the title. This is because there are sometimes a mismatch between the topic and the content. Therefore, it's important to read the manuscript upon receipt to know what is being shared and what's being communicated. Next, you need to ask yourself if you have the expertise in the focus area of the manuscript to be reviewed. I mean, I know my areas of specialty, and so if something is sent to me that doesn't fit my area of specialty, I nicely reject the information and let the editor know that, please, this is beyond my ability. There's nothing wrong with that. Now, some manuscripts are lengthy and others have short turnaround time. So you need to check your schedule for availability. Do you have the wherewithal to review and submit a quality review to the journal within the requested time frame? You see, maybe a manuscript, or maybe a manuscript you submitted to a journal was rejected, and so you are unhappy. Or maybe you are biased when it comes to certain topics. When you receive a manuscript to review, you need to ask yourself if you can set aside your feelings and your biases and whether you can be objective. You also need to check to see if you are in any way associated with the manuscript you are supposed to be reviewing. Do you have anything to gain from accepting the manuscript? If the answer is yes, then you immediately need to inform the editor. You also need to find out if the journal has specific guidelines for the review process and how the editor expects you to submit your comments. Now, please note that the peer review process is to ensure that the manuscript is easy to comprehend, lacks any gaps, and is significant to the research field. It also ensures that the research findings are valid and reliable. Without an effective and rigorous peer review process, manuscripts may disseminate false or flawed knowledge to the public. So what should one look for during the peer review process? Well, from my experience, I'd say originality, importance of the work to readers, and scientific reliability. So let's take it from the top. Originality. Is the work original? And does it add substantially to the scientific body of knowledge? In other words, does the work add to what is already known? What is the literature saying? Is what is being presented to you already known? Like Dr. Salihu said, then why are you wasting people's time, right? If yes, what does it add? Does it add new knowledge or does it expand on what is already known? Importance of the work. Does the work matter to the target audience of the journal? Will it help the audience make better decisions? Is the journal appropriate for the manuscript? Moving on to scientific reliability. Some of the questions you need to ask yourself are these. Does the manuscript contain all the required parts stipulated by the journal? Is the research question clearly defined and appropriately answered? Or is the research purpose clearly articulated and achieved? Are the methods used adequately described? Are outcome measures clear? Do results answer the research question? Are interpretations and conclusions derived from the collected and analyzed data? Are references current and relevant to the research topic? Do they follow the journal's writing style? Are there any glaring omissions or gaps in the manuscript? And last but not the least, is the manuscript written in plain language? You know, if I read it for the first time and Dr. Salihu or Dr. Azwini read it for the first time, would they get the same understanding or do they have to read it 1,000,000 times before they get to that understanding? Can the audience easily understand what is being communicated? Are there grammatical and editorial errors? So when it comes to providing your comments to the author, please start with what is positive about the work. Sometimes people are hesitant sorry, don't hesitate. People are in a hurry to tell you what they think, but it doesn't hurt to start with what is positive about the work. Briefly state the strengths of the manuscript and how it contributes to science. Clearly, I mean, the authors believe their findings are important. That is why they submitted their work to the journal for publication, right? Next thing you want to do is to suggest rather than demand. When you make suggestions, frame them in the form of questions, not demands. You see, people respond better to helpful suggestions than to critical demands. For example, you can ask, oh, is it possible that an additional interpretation of these findings could be X, Y, and Z? Don't say, I think you are completely wrong, and I demand that you do this additional control to prove that I am right. You will turn the people, you will turn the authors off. You know, yours is to serve as an advocate for the journal and for the readership, right? So you've got to be careful. Now, you do not have to be antagonistic, right? When providing feedback, please do not attack. Do not be rude, mean, or insulting. Don't tell the author or the authors that they are wrong. Don't use judgmental language. Avoid using exclamation marks, capital letters, bold, or underlining words. You see, there was a time I read a reviewer's feedback and I began to feel angry. My question was, what did I do wrong? All I did was to submit a paper. Tell me what you need. Why are you insulting me? Right? So these are some of the things we need to consider. You also need to be very clear with your comments, right? Don't say work on the methods. I mean, that is vague. What specifically needs to be worked on the methods section? What particular things need to be sorted out? And then use the passive voice, right? You know, this is because it draws attention away from the author whose work you're reviewing to the work. For instance, saying that the abstract needs to be rewritten sounds better than saying you wrote a bad abstract. You know, you need to think about these things. So these authors also have feelings, just like you. And then provide location of your comments. So indicate very clearly on which page and line number your comments can be found. That way, the author or authors can easily find what needs to be fixed. It actually reduces frustration. And then don't be too late. Think of yourself as an author. You've worked so hard to prepare and submit a manuscript, and then now you have to wait and even wait and wait and wait. You know, try to keep time and keep it to as short a length as possible. You see, we should not be a barrier to the process. We should rather facilitate the process. And to my final thoughts, you know, the peer review process is not without its challenges. This notwithstanding, it's a fulfilling and good skill to have, either as a student or academician. I'd like to bring my presentation to an end here and hand it over to Dr. Azwini, and hopefully we get some time to answer some questions when we get to the Q&A. Dr. Azwini, over to you.
Thank you so much, Dr. Armstrong-Mensah. This is really great. Even as an editor, I have learned a number of things. Sometimes many of us on this call, because we are doctoral students, we are PhDs, we are MDs, or we are researchers, the mindset is that you should be critical to your colleagues. But from today, I have learned that actually we need to be courteous. You know, we need to present your feedback as if that person were sitting before you. So this is really, really very helpful. And I hope as you begin your journey, as you continue your journey in academia, you will take this into heart and be courteous. You know, authors are human beings like you, right? They have feelings like you. Share feedback to improve the work. So now I'm going to go quickly through a smaller section of this, which is to walk you through our own review process for our journals, to put everything together to tell you how you as a reviewer will document your reviews and share them with editors. You know, the editors could be Dr. Mensah, it could be Dr. Salihu, it could be Dr. Singh, in a way that is really, really very constructive. So Brown, I hope I'll be able to share my slides quickly, and then, okay. Can you guys see me? All right. Yes. So for our journals, I just want to begin that our organization, the Global Health and Education Project, is a nonprofit. We are seeking to address and eliminate health disparities by addressing the social determinants of health. The two journals we publish are helping us to support our mission. And the most important reason why we publish these journals is because, as Richard Horton, the editor of Lancet, pointed out, researchers from developing countries do not have the same opportunities to publish in top global health journals. So the work that we are all doing today, bringing you out on a Saturday, is really to support researchers in the global South and also to foster collaboration between researchers from across the world. And that is exactly what our journals are seeking to do. You now must have noticed our two journals. One is the International Journal for Maternal and Child Health and AIDS, IJMA, and then the other one is the International Journal for Translational Medical Research and Public Health. So whether you are working on HIV and AIDS, maternal and child health, or you're working on public health and medical research, our two journals provide opportunity to disseminate. In reviewing for us, and I hope that all of you who have registered for this seminar and here today will consider becoming our reviewers. The first thing you will do is to register as a reviewer. Very simple steps. You go to the website, MCH and AIDS, you click the register button, and that button gives you opportunity to provide your name, your email address, and give us some information about your specialty. And then the journal manager will enroll you as a reviewer. Once you are enrolled as a reviewer, and we find out that you have some expertise in an area of a journal, you will be able to see your registration in a dashboard. If you go to the dashboard, you're going to see your queue, you're going to see the number of papers you have been assigned, and you can actually see the title of that paper and make a determination whether this is within your area of expertise. And I wanted to note here that we do really love graduate students to learn how to review, because this gives them the opportunity to hone their skills in public health and global health. So once you are there and you are assigned, you're able to click and you're able to view what the manuscript you are going to review is. And then there are 4 stages. The step 1 is you are going to see the review. You're going to be able to see the abstract, which is the summary of the manuscript. And with the abstract, you will actually find out whether you are eligible or not. If you think you do not have expertise, you can, at this point, decline. And then here, once you go into accepting, you will see some guidelines. Some of these actually are highlighted by Dr. Armstrong Menser, which is to look at the introduction. We need you to know conflict of interest, because we do not want to review papers by your colleagues or by your friends or by your family members. We want you to accept to confidentiality. We want you to read our plagiarism. Every paper that we publish goes through authenticate review to see whether there are any plagiarized material. And if there is an enormous plagiarism, we do reject them actually. Fairness. Dr. Armstrong Menser talked about fairness. Be fair. If you are the author of this manuscript, the comments you are providing, will you provide those comments to yourself? Timeliness, recommendations. And then you're able to download the paper. Now you have read all the rule, all the ethical issues, you can download the manuscript and walk through the Word document of this manuscript and review each of the sections, remembering what Dr. Salihu talked about, the different sections of the paper. Once you have finished, it is now time to write and submit your review comments to the editor. Few questions. It will ask you, does this manuscript pose original question? Is it important? Are the research questions well defined? Does this manuscript use data that are sound and well controlled? Are the methods appropriate and well described with sufficient details provided to allow others to evaluate and replicate the study? You can see all these are actually the key points that Dr. Salihu went through in the sections of a manuscript. We need original question. we need a controlled study, we need a really detailed methodology, because we need your paper to be replicable by other researchers, regardless of whether they are. If you are in India, you conduct a study. If it is well described methodologically, somebody in Nigeria should be able to replicate that paper. If they are not, you have not described your methodology very well. And then are the results and the interpretations, are they very balanced? Dr. Salih spoke about, we don't want to making sweeping comments. This is the greatest paper in the world. There is no paper like this in the field of pediatrics. We don't want you to do that. You need your results to be well balanced. And then you go to highlight what are the strengths. Like Dr. Armstrong said, we begin by strengths. What do you like about this paper? What are the key things that you find interesting in this paper? And then you move on to write about the weaknesses. And then you give suggestion, being courteous. What and how can this manuscript be improved? Be specific. In the methodology, I would like to see a description of the analysis. I would like to see a description of the variables. How were the variables operationalized? I would like to see a clear definition of the exposure and the outcome variables. And then which specific sections of the paper do you want us to revise? You're not just going to say, this is a horrible paper, nobody should accept this paper. You should be specific to say why, what sections. And again, for us as two global health journals, we ask you to provide some global health implications. And then we talk about any ethics. You know, do you think this is funded by a industry, but they did not disclose it? Do you think individuals were enrolled in the study without proper consent? Do you think people have been asked to answer questions that will be stigmatizing? We need you to do that. And then for you, we also ask you. And then at the end, we give you the opportunity to provide a confidential note to the editors, telling them what you found very troubling about this paper, if any, or what you find really helpful. You can tell them that this paper, I understand, was written by junior faculty, but I think it warrants some mentoring and support. And then once you finish, you upload and you get a final acknowledgement. Dr. Mensah talked about what and why do you do peer review? Globally, peer reviewing is uncompensated, but there are very, very many benefits. So in our journal, we try to support researchers. A couple of things we have done is we have reviewer credits that we give to them. So the more you review, the more you accumulate credit, and those credits can actually be used by the journal, either us or any other journal that participates in this program. And you can use your accumulated credit to get waivers or discount to things like e-learning courses, like publication fees or conferences. And then the other thing, this is an instruction, the other thing that we do is also to support our reviewers with letters of employment. I have heard people trying for us to do letters for them, for their employers, for references based on their scientific review for us. And we also try to give them opportunity to highlight their work on our social handle. And then we give our reviewers also waivers and discounts for article processing charges. Finally, if you review for us and request it, we have reviewer certificate that we can offer you. This is a sample for it, and then another sample for the reviewer for this. So please feel free to get in touch. If you send us your questions, we should be able to answer those questions and answer and give you pre-employment any questionnaires, and follow us on social media. So now, Brown, I'm going to stop sharing and we can get into the question and answer component of the program. Crystal, I think you're going to be reading the questions, and then we're going to be sharing that between Dr. Mensah and Dr. Salehi. So I'm going to take the first question from Urosa Safraz. It says, is it necessary to have many publications to be part of peer review, or fresh researchers can join? Dr. Salehi.
Hello? Yeah, so when you say fresh, it depends. Are you undergraduate student, graduate student? At what level are you? Because I encouraged, and this could be part of the mentoring process. I call it a mentored peer review process. So usually I do it in a group, like we have a group of undergraduate as well as a graduate, and then the graduate students would be the main person that will do the peer review, and then we hold a meeting supervised by me and my other assistant, and that way we go through what they've written, we correct it, etc., etc. We do that like once a month, and that gives them an idea. You don't allow, there is no way they can do it independently and do the right job, but definitely, just like medicine, you have to start from somewhere. You have to start training them. You just don't ask them all of a sudden when they are faculty to start peer review. Well, it's not that they cannot do it as faculty, but then you miss that window of opportunity of mentoring so that the early programming can commence. And because early programming is a very important thing, students tend to be more effective later in life when they learn it much earlier than learning it late. So I don't think we should mystify peer review process. If we want them to write papers, which these days to be competitive to go and be a postdoc, you have to, you know, if you have 1 or 2 publications, you are better off than somebody who does not have any publications. So I believe, and that's what I do, the peer review process should be a training program that is merged within a mentoring program. So if I have a paper and I want to peer review it, I give it to the students, and then they do, and then we meet, and then we share the. Then I correct them regarding what they've done. Definitely, another thing to consider here is the concept. Some journals require that to be confidential. So what I do, and you can do it, is to tell the journal that part of the reason why you're faculty is to mentor students. And part of the reason why you're faculty also is to create the next generation that will take over, and that to be beneficial to the student to participate. You don't need to give them the details, but you want the student to participate so that they learn the correct way to do peer. Most journals say yes. They're even happy because for them it's part of the visibility, and the student will know about those journals, and then they become their clientele by the time they become faculty. So that is my take on it. Begin very early. Early programming and anything in life has been shown to be more effective than late programming.
Dr. Armstrong-Mensah, I know you have a lot of experience helping even undergraduate students to publish their papers, as well as Dr. Salihu. Can you comment on that? How possible can we take on junior faculty, undergrads, grad students, and help them using peer reviewing as a mentoring opportunity?
Well, thank you, Dr. Azwini. And I think Dr. Salihu mentioned that, the thing is, once you take students through the process and they begin to understand what it takes to do research, just as Dr. Salihu began to outline, he didn't get to finish. Once students begin to understand that process, and they've done it a few times with you, and you are there to serve as a backstop, it becomes something that they learn and something that becomes, something that they can use going forward. So, I think just engaging them in the process, just giving them the opportunity, puts them on the right path to be able to do that, and even better going forward.
I have another question from Ashraf Zakaria. Ashraf is asking, as a writer in the field of environmental management, which journals are best suited for papers in these fields? I think that is going to be out of scope here for us, but he asked a very important question, which is, can one present papers to different journals? And if so, what might be the negative effect on career and promotion? I'm going to ask you to take that, Dr. Salihu. I think this is about multiple submissions.
Oh, no, it's not allowed. You submit like to 10 different journals at the same time. Most journals, many journals, you have to state that, at a specific point in time, they're the only ones, because otherwise you're utilizing resources at random, and blocking other individuals. So the best way is to submit to one journal and then wait for the submission report from that journal before you send it. If they refuse, then you can, or if you withdraw, even if the journal says we're going to, we're going to accept it. If you don't like their comments or you don't want to change something, you can tell them that, look, because you asked me to do this and I'm not going to do it, withdrawing my paper, then you look for, another place. But if you just utilize resources of people like that, send in just one single paper where you have 10 or 20 reviewers looking at just your paper, it's very unfair. We have very few reviewers on the planet. So you have to be patient, just like everybody else. And it's about utilizing resources in a very good way. And most of these reviewers, they do it free. They are not being paid. So you can't just utilize reviewers at random just because of one paper. You utilize 10 reviewers, 20 reviewers. Is very, very unfair. That is my own take. And I think most journals discourage that kind of thing. It's not ethical, really, to do that.
And if I might add to what Dr. Salihu said, it's not uncommon to repackage and send to another journal if it's been rejected elsewhere. Then that way you are not sending them out simultaneously. And like Dr. Salihu said, it is unethical. They will ask you, are you submitting this journal for the very first time to just this manuscript to this journal for the first time? And your answer should be yes. But if you know you've submitted to several, then it means you can't. But it's not wrong to repackage your rejected journal. So for example, journal A rejected your work. There's nothing wrong with taking it back, repackaging and sending it to journal B. That way it's not simultaneous. It's you haven't heard from that journal and then now you're repackaging and sending it elsewhere.
Very good. Another question from Tochukwu Boluche. He asks, as a reviewer, do you reject a manuscript without an abstract after accepting to review it? Dr. Armstrong-Mensah?
Yes, I saw that question coming and I was smiling. I mean, the thing is, it depends on what the journal outlines say. I mean, if the outline is saying that people need to provide an abstract, I don't know that I'm going to reject it, as I'm going to reach out to Dr. Zwini and say, for example, if it came from IJIMA, to say, well, Dr. Zwini, I don't see an abstract. Is it really critical? I mean, how are we missing this, right? So then it's for the editor, and I don't think it will get to me. It won't go past the editor if the person submitting has missed certain components, right? So if it's critical to the journal, then it won't get to me as a peer reviewer. Once it gets to me, it tells me that the editor is okay with what has been presented and is saying, now do a deeper dive to see if, this warrants, publication in our paper or not. Sorry, in our manuscript, in our journal or not. Yeah, this is my take. I won't, at that point, it's gone past. Before it gets to me, Dr. Zwini or whoever the editor is has made that decision. Yeah.
And that is correct. So once you submit a manuscript to a journal, there is what they call the desk review. During the desk review, the editors or the journal managers are checking, is the submitted manuscript within the scope of the journal? For instance, IJIMA deals with maternal and child health and HIV/AIDS. If you submitted a paper on soil science, that paper immediately is going to be rejected in desk during the desk review and returned to you. But there are also occasions where the paper is very well methodologically very strong, but the authors, due to one thing or the other, did not include an abstract. The journal manager or the editor can determine and say, yes, we want it to continue and proceed to review. And then based on that review, remember, the paper will still be sent back to the authors to revise, and then during the revision, they can add the abstract. But the key goes back to what Dr. Salihu said, make that paper to be punch, so that once the editor reads it, whether you have an abstract or not, he or she will be so compelled and like the paper that she will say, go ahead into review. So that's about process. And I see another paper here, another question here from Dania Al-Kasab. Dania asked, regarding plagiarism, is there a software that we can use to check the originality of the paper? And that's a good question. Before the paper goes out to review, the journal manager already runs the plagiarism check. She confirms that there isn't excessive plagiarism. If there is, normally what she will do is she will alert me or the executive editor or the editor to say, I have excessive plagiarism here. And most likely 9 out of 10 times that paper will be rejected at that spot. So you as a reviewer do not have to worry about doing the plagiarism check. It is already done during the desk review. Keep the questions coming. I have another question. Another question from Chukuma is asking, what is the benefit of Publance to the reviewer? Publance is another service. In IJMA, we use reviewer credits. Publance does the same thing. You can accumulate credits the more you review for manuscript, you review manuscripts, and then using those, you can get some incentives elsewhere. We as a journal made a determination to use reviewer credit, and you can use reviewer credit for us, and then we can use it to do some waiver for you. Another one. A question here from Tanisha Wright Brown. She is asking, I am interested in writing the discussion of an article that is based on a particular theory. Do you have a recipe or outline for incorporating a theory in the discussion section of an article? This is an important question. So Dr. Salihu, let's begin with you.
All right, thank you so much. I had that in my, okay, let's go to the discussion section. The way you write the discussion section, let me go to the, okay, discussion section, usually the way you write it, discussion section. So we have several paragraphs, and this is just to answer your question very fast. The first paragraph is you summarize the main highlights. What are the take-home message in what you presented? What are the main findings? So you remind the reviewer, okay, these, we found this, blah, blah. Because by the time the reviewer comes to this, arrives here, the reviewer has forgotten about 50 to 60% of what you've said. I mean, we have so many things going on in our lives. So it's only fair to capitulate what the main findings are. And then the second paragraph is consistency. Okay, compare your findings with other findings in the literature. How are they similar? How do they differ? What are the reasons for the differences from what is known in the literature? Things like that. So that should be the second paragraph. Then the third paragraph would be the mechanistic explanation. What are the pathways that explain your findings? Okay, what do you think is responsible for your findings? Then the fourth paragraph is, what do you think will be the inherent, the inherent reasons why your findings may be explained by certain, what I call certain deficiencies, such as confounding, selection bias, effect modification, etc., etc. We don't have time to go into this, but those are things you need to really, in order to convince people that your findings are really solid and valid. Then I explained confounding here, what selection bias is, effect modification, what they are. Then the fifth paragraph should be, okay, like in my own area, I deal with either clinical things or public health things. So you have to talk to us about, okay, so what? You found this, that. What does this mean? What is the implications regarding the field you're talking about? Has it advanced it forward in terms of knowledge, in terms of practice, in terms of understanding the underlinnings of a disease process in the population, dynamics of burden of disease in the population? Have the trends changed? What does it mean? So this is what I call public health or clinical implications of what you're talking about. Clinical wise, talk about guidance. Do we need to change the guidance, the way we manage people with diabetes, the way we manage people with hypertension, the way we manage people with arthritic diseases? What does, so what? That so what question is very important. That should be a fifth paragraph. And then the sixth paragraph, talk about limitations, talk about the strengths and limitations of what you found, and then finally, the seventh paragraph, what do you propose to be the future direction? What is the next step? What is the next research agenda, et cetera, et cetera, et cetera. So in brief, this is the way I could talk about the theory. So it's not a theory, it's a kind of organizational approach. And then within the organizational approach, you can embed theoretical framework. For instance, mechanistic pathway. Is that a psychosocial theory that, is it a psychosocial theory that explains what you found? Or is it a biologic plausibility pathway that could explain what you found? So probably you can look at it from the point of view of, okay, this is my outline, and this is the underlying theory that explains my findings. I hope I'm able to briefly address that. Question you've asked could take us a whole day, but briefly, that is the approach you should have when you're writing the discussion section. Actually, for me, the easiest part of a manuscript is discussion question, because I usually, when I started as an assistant professor, I usually started, and I don't know why, maybe because, I don't know, maybe my brain is weird somehow, but I usually start with the discussion before I even see the result. And I found it to be the best way to do, because I already know what I want. And when the results come, then I modify accordingly, and it becomes much easier. But I realize that most people, most of my, almost 99% of the people I've mentored, they feel more comfortable to see the result first before they write the discussion. So I hope I'm able to answer. So that is a brief answer to your question regarding theoretical approach and theoretical underlinings of it.
All right, moving on. We have another question from Christian Asensio. Christian is asking, how long does it take an experienced reviewer to analyze a paper? Dr. Armstrong, Minister?
All right, so thank you very much for that question. So it depends. For me, it depends on the quality of the paper. If the manuscript is very well written, maybe within 2 or 3 days, I'm done, right? Because first time you want to read the paper and make sure that you understand what it's all about. Second time you want to sit down and begin to do a deeper dive. Third time you're trying to really put down all your comments, make sure everything is right. So it depends. There are times when I've told Dr. Zwini, this paper, I'm not sure I can finish it now, right? Because the language is so bad and it's so disjointed and you just don't know where it's going. There was a time I received a journal manuscript that comprised 72 pages, and I wrote to the editor to ask, is this a book? And they said, no, it was a paper. And I said, you know what, I can't review this because 72 pages of bad language, I don't know when I'm going to get done, and I don't want to hold the process back. So in summary, it depends on the quality of the paper and whether I do have time. And before I accept, I make sure I have a resource. Okay, I think someone, yeah. So for me, if it's good quality paper in the sense that the language is okay, the grammar is fine, give me 3 days, give me a week, I'm done. But if it's not good, then it's going to take a longer while.
Good. And that highlights the importance of collaboration. For most of us for whom English language isn't our primary language, it is important to foster collaboration with original language speakers, or even though they are second language speakers who have done a lot of work writing and understanding the mechanics of English language. Nothing is off-putting more than a manuscript that the first sentence is incorrect grammar. Even as an editor, there are manuscripts I see, I want to push them. I have to confess that I have to push them right away to review, but there are some manuscripts I would say, I'm going to come back to this one later on. Truth be said. So the other question we have here is from Maria Paz Carlos, and she's asking, if a paper we have is MCH field, and MCH public health epidemiology work, these are not academic work, they are lessons from the field. How soon will we hear back from IJMA on these kinds of papers? So Dr. Salihu, I'm going to let you talk about this. This is your field. The two journals, especially IJMA, does IJMA accept papers that are not pure research, but these are papers that contribute to understanding in the field?
Yes, to that specific question, the first part of the question, yes. I mean, it doesn't have to be like something that is based on hypotheses. We receive and we accept papers that are written based on the lessons learned in the field. Very, very important, because there are two aspects of it. There is the scientific aspect and translational aspect. Okay, what are the challenges when you are really trying to implement this intervention that has been shown by science to be evidence-based? What are some of the challenges? How have you been able to modify what you're doing so that you address certain intricacies within the population that you're practicing? You know, so this is, or is it a practice guideline by an organization in your area? Let's say the Nigerian Medical Association or Nigerian Medical Council. How will this impact the lives of women, the lives of children in that country? What are the expectations? Is it, and we're very interested in policies, especially. What do policies in these countries, like to address polio, residual polio in some countries, in developing countries in Asia and Africa, although very few countries now, what are the policy implications, et cetera, et cetera? Okay, the policy implications have been implemented. What lessons have been learned? What are some of the inadequacies? How would the global community contribute to addressing these inadequacies? How will exchange of ideas and fertilization of ideas take place, et cetera, et cetera? So it's an ongoing dynamics, you know, and this sometimes can be very, very interesting, and not only interesting, but it gives a perspective to other regions of the world, what to expect when they conduct such policies, et cetera, et cetera. You know, what does that mean when you increase, for instance, the tax on alcohol or tobacco smoking? What do you expect to get? You know, what have others learned from such policies, et cetera, et cetera? So yes, the answer is yes, this could be very, very interesting. And this is what we call translational public health or public health practice, et cetera, et cetera. How long it takes usually is shorter than the peer-reviewed journal articles, because we are not looking at scientific rigor when we look at that. No, that's not where the interest is. The interest is the implementation aspect of it. You know, what is it that you're talking about, and how will that help inform policy or inform other practitioners regarding some of the obstacles that you've been able to overcome, or you are in the process of looking for solutions to overcome?
Thank you. So this other question, Dr. Armstrong-Mensah, I'm going to give it to you. This is about having a very large number of authors. So wearing your hat as an editor, how would you consider a paper that has like an entire community of authors on it?
Well, basically, I don't see why that should be a problem. I mean, some journals would say when they give you the guidelines, they might say not more than 10 authors. Some also don't say anything. So if the journal hasn't put a limit on the number of authors, that shouldn't impact my work at all. Mine is, I'm looking at the quality of the paper that's in front of me. I'm looking at whether they've met, you know, all the things that they need to meet. If it's 100 authors and the journal editor says it's okay, that won't be my issue. Mine is the content and not the number of people who are submitting. Dr. Azwini, I don't know what you look for in terms of the number of authors, but that hasn't been a problem for me because I'm focusing on the meat and potatoes.
Great. Dr. Salihu, what do you think? A large retinue of authors on an 11-page paper with one objective and 3 research questions, and there are 25 authors.
Okay, I agree with what Dr. Mensah said with a caveat here. It depends. I have 2 hats sometimes. One, the executive editor. It depends on what the paper is all about. If it is a multi-institutional collaboration, obviously you have to allow people who have contributed one way or the other, and it's multi-institutional, like a multi-site randomized trial, something like that. I mean, you can't prevent them from having so many authors. If it is multi-country, you have people from the French speaking part of Africa contributing, people from the English speaking part and the Portuguese. You can't say, okay, the Portuguese, I don't want them to be there. You can't do that. You can't prevent people from collaborating. At the same time, if you're talking about a small paper, seriously, a small paper from Houston, and then it has people from Liberia, people from Singapore, people from South Korea, then that becomes problematic. Seriously. And as an editor, I usually ask, politely, of course, you ask them the contributions of each one of them and how that contribution took place. And in most instances, they are not able to give you any tangible reasons. Then you say, okay, seriously, you need to reduce the number of authors that you have on this, because this is like a small data that you have. It's not like multi-country collaboration, but you have people from all the continents of the planet. No, so it depends seriously on what the paper is all about.
So good points. As an editor, one of the things we do, especially because of our developing country leaning stance, is to bring equity in co-authorship. I have actually requested authors to do the opposite. I have seen a paper where a graduate student submitted manuscript based on their dissertation or thesis, and they were the only author on that manuscript. I wrote back to this individual and said, this paper looks to me that this is your dissertation, and I know you cannot do a dissertation without a faculty. Where is the faculty that supervised you in this work? And I even know that you may not have had only one faculty, you may have multiple faculties. I told him, I said, if you are unable to reflect the authorship and let those faculty know, then we wouldn't consider this paper. And that is very important. As a policy, we want to support researchers from developing countries, but we need to mentor them on the ethics. You don't go behind your supervisor and submit a paper to a journal and then it publishes, because that supervisor doesn't get anything paid for supervising you. The only thing they get is that there is co-authorship. That's one. The second point is that if you had a faculty who actually knows how to cross the T's and dot the I's, they will not let you submit a substandard paper. So there is a quality assurance component there, that faculty who sees that is really going to be rigorous in the paper, and therefore may not allow you to send the paper out with their name on when the paper is half-baked. So we try to protect professors. We also try to protect students. We have had a situation where a paper was submitted, I'm not going to call the name of the country, and this was submitted by the professors, and the student's name was not in the paper. And we figured that out during the revision, that we gave them review comments. They couldn't address those comments because they did not do the analysis. And then the student wrote us back saying that the paper has been submitted based on her dissertation, but her name was not there. You see, it gets messy and messy and messy. And so we provide opportunity for teaching. Usually I call on Dr. Salihu or Dr. Armstrong Mensah to do the teaching, right? To really tell them why you need to have people determined to be co-authors. So that's what I'm going to say about that. Be fair. If you're a student, be fair to your faculty. If you're a faculty, be fair to your students. But have opportunity to have discussions around co-authorship even before the paper starts. I have another question here about how can reviewers assess and utilize the reviewer credit? I'm going to answer that before the other one. Reviewer credit, once you complete a review for us, the journal manager, in the letter you get thanking you, you will get a link to reviewer credit. You register with reviewer credit. They get back to us to confirm whether you have done a review for us, and the journal manager will confirm that, and then you get your credit. So that's how that process works. And then I have another question here from Bernard Gogo. He asked, manuscript has no literature review according to the presentation. When submitting thesis or research project that has literature review, how does one go about the literature review section? So Dr. Salihu, maybe you can, in 1 minute, go through that again so that we can wrap up. We have few minutes. We want to respect people's time.
Okay, sorry. So it's about literature review?
Yes, what are your top tips for writing a literature review?
Oh, okay. Well, the most important thing is you have to do a very thorough search, and you have to consult, the PubMed, Google, and make sure before you start doing that, and that's what I've realized with students, you just have to undergo the training how to do it. I mean, there is a tutorial for PubMed, Google search, etc., the other search engines, and then you will know how there are certain technical steps, how to utilize mesh words, how to utilize keywords, how to combine, etc., how to exclude, how to include, where to put a comma, where to put things like that. So you really need to do that, to have some kind of orientation, and is especially for PubMed is very easy. And once you undergo that training, then you will be able now to utilize the search engines to be able to get the kind of literature that addresses the topic that you're dealing with. That, to me, is a very important step that people have to take before they start looking for anything. And then once you go, and that is something I want to advise every student, especially because we had a student who did all the work but did not document what she was doing, and she had to go back. So when you start, the moment you start, make sure you have your inclusion, your exclusion criteria list ready. And then each time you run through the process of, you do the search, make sure you document how many that search. We know that the numbers will change over time because people are still producing. I'm publishing on the topic probably, but make sure that you document that from this period to this period, you conducted the search, and this is the number of articles so you start with the larger, what we call the wider search, and then before you narrow it down to the kind of information that you want to be present in those articles before you include them. That is a diagram that you need to provide. The diagram is very, very important. That diagram, I don't know, maybe I should show an example here. Let me show an example. Let me show an example of the kind of diagram that would be of utility give me a second. I hope, are you? Okay, good. All right, so, all right. This is the diagram, an example. So you need to give a diagram like this so that at each step, you have to tell, you have to say, okay, you excluded this because of this, because it's not in English language or something. So at each step, you have to show the number that you've removed from the search that you're making and how you narrow it down. Because initially you might start with about 10,000, and then finally you narrow it down to maybe a few dozens, like 30 or even 20. But you have to show people the pathways, that diagram that I've showed you, the flow. How did you come all the way from 10,000 to 20? So that is very, very important. Now, this is very important if you are going to do a review article, right? For the literature search for a review article. But there is a literature search just for your original article. The literature search for your original article does not have to be so exhaustive. All you need to do is to get the articles that, that address certain areas that you're looking at with very good specificity. And then once you have an idea, how do you synthesize them? Now, students find it difficult to synthesize information from different directions. And that took me time to show them how to do it. So there is information synthesis. And the way you do information synthesis is you look at it as several buckets containing different fruits. Now, you don't want to utilize all the fruits. It doesn't make sense. So how do you pick the most relevant, the best fruit from each one, or the most relevant to synthesize the kind of information you want to synthesize. So I think that is where probably students have big problem. They will read and read, but then if they write it, you know what I see? If they write it, you see that they're describing all the studies finally. That is what they're doing. So there is no synthesis, but there is description, which is a big step. So once they write the description, what I tell them is to coach them how from these descriptions, how to tease out the most important points and how to bring commonality to certain points. So, and that is the point. Students sometimes find it difficult to find that commonality because they may be describing about 10 studies and the 10 studies are describing the same thing. So how do you bring commonality to them? And how do you tease out things that are outside the communality and show conflict from the rest, things like that. So it's a very time-consuming process, but I think it's worthwhile that we teach our students, we mentor them regarding each of the steps. So it depends. In short, is it a literature review paper, in which case it has to be exhaustive, or is it just you're doing literature search for your original article?
Folks, it's 1 p.m. Eastern Time in the United States. I wish we can continue having this discussion, but this tells me one thing, that there is need in bridging the research gap, the information gap globally. And I do really want you to join me to thank our two facilitators today, Dr. Armstrong Menser and Dr. Salihu, for providing terrific, even for me as an...
You're muted.
I am sorry. So folks, two minutes past 1 here in Washington, D.C. I want you to join me to thank our two wonderful facilitators who took their time today on a Saturday to come and provide this training. I see the need. I'm seeing a lot of people even writing me in private chat here for the need for us to be able to go in depth for each of the sections. And I promise at the end of this seminar, if not now, Brown is going to send out a survey, and do please let us, did you like the presentation today? Where can we improve? And there are other topics that you would like us to spend an hour delving on. And then we will do our best to continue to support. United States and the global health community need your support in terms of productivity. And we are here to provide all the mentoring and all the coaching. So thank you for joining. Thank you to Dr. Salihu. Thank you to Dr. Armstrong Mensa. Thank you to Brown. And thank you to Crystal and everyone who came out today to join this. Really have a wonderful weekend, all of you. And bye-bye.
Bye-bye. Thank you.
Thank you so much.
Bye. Thanks for having me. Bye.
Thank you. Nice to meet you.
Thank you.